My name is Bradley Dick, and I am the co-founder of Zero Divide AI.
Mike Mosquito. I lead emerging technology and innovation in Northeast Georgia.
I'm Andy Miller. I am a healthcare journalist. I am a correspondent with KFF Health News.
Hi, I'm Kelsey Mayo. I'm the co-founder and CEO of Armor Medical.
I'm Khan Siddiqui. I'm founder and CEO of a company called Hopper.
How are emerging technologies shaping the future of healthcare, and which will have the greatest impact?
You know, it's interesting because I come from a background where I'm very comfortable working with big data ecosystems. And it's fascinating to me to see the way that machine learning methodology, artificial intelligence are really influencing every part of our businesses, from the innovations that are driving forward the future of healthcare to the way that we're operating our businesses. And so, you know, to me, that's something that we maybe take for granted because it's such a part of the fabric of our conversation these days. I'm going to choose to focus specifically on maybe the innovation side in women's health. So something that I think is really powerful is how we bring together data from all of these different sources, be it from the electronic medical records, be it from wearable devices that we have, like the wearable that my company is developing. In addition, other data from our biology, our lifestyle. How do we bring this together in such a way that, number one, we respect the sensitivity of that data and the trust of the people who have provided that data to us? I think that's huge in women's health. Number two, how do we apply these methodologies, these artificial intelligence, machine learning methodologies, to drive forward, you know, new innovations, new opportunities for really changing the landscape of how we think about preventative health, how we think about personalized medicine, especially in women's health. So we're at a tipping point here. I think the future is going to be pretty incredible to behold.
Well, AI is having an impact. It's kind of marketed to have a bigger impact than it really is, because you have to have an ROI in most health systems to buy or to actually invest in a new technology. So I think that it's making some impact, especially when you have physicians being given back time in their evening. I think the DAX nuance relationship inside the physician's practice has changed that landscape of patient and doctor relationship in the room. So AI is giving us something for the patient side and the clinician side. Wearables, IoT, wearables they've come a long way in the past 10 years. And I think you'll see those advancements. Dr. Jane Morgan, she talks about the wearable blood pressure club, where you track yourself. It's self-management, that you now can have a more educated conversation with your doctor. So I think that that's really important as we start looking at how do you self-manage when you can't get into your primary care physician. I mean, that's the number one thing right now. Primary care physicians are overloaded. I booked my own primary care physician, and they gave me a 6-month lead time to have my physical. That's not feasible in today's market, right? To be able to wait 6 months on your physical when you only get it once or twice a year. And so how do we use these new tools, this new innovation, to have better self-care, better managed care, but also put those tools into the rural community where they may not have a hospital or a plethora of doctors to go see. So how are these tools going to be used inside those rural communities?
I think AI is going to have an impact on every aspect of our lives, including healthcare. I think the possibilities are that healthcare for individuals can be improved somehow, some way, whether it's understanding how someone is in pain, for example, and being able to suggest remedies for something that's maybe a chronic condition. I don't know much about AI, but I know that I did talk to someone who may have a cancer diagnosis, and she's going to a physician who is able to use AI to hopefully be able to detect whether she has pancreatic cancer or not. Something like that is, everybody would welcome that development. And maybe AI will help diagnose her if she is indeed having this cancer.
Yeah, that's a very interesting question. If you think of it that way, there are generational technologies that create fork in history. So it was transistor that made computer evolution start. It was internet that got that started. Then mobile came on board, and now AI is the next one that's going to create that exponential change in technology. It is really hard to predict how use of things are going to be. So if you think of it that way, it's all about making us more efficient and more powerful. In 1900, there used to be a job to be done, which was if you had to go to a restaurant from your home, a driver would come in to pick you up and take you there. But the tools it'll use would be a horse carriage. And the skills what we need is riding a horse, taking care of a horse, cleaning the dung and feeding hay to the horse. Today, million-fold more people do the same job, right? They even bring food to your home. But guess what? In 1900, there was no job to take you to the airport because airplane wasn't invented yet. So and you couldn't even imagine in 1900, if you went back and time travel back there, that there will be something called a ride to the airport because people don't know what airport was. So we are at that moment right now where we don't know what these technologies are going to change and how they're going to change our lives. So how do you imagine the new? We kind of think about future as what we are doing today and not realizing that it's all exponential and new things going to come out because of this innovation that is happening right now with AI and mobile and real-time information and all of the stuff that is happening. And it's really hard to predict what that's going to be. So really excited to see how this impacts patient care. We're already seeing results of AI really making a difference in patient outcomes, especially in medical imaging. There's been a lot of work to show that just in medical imaging in 2020, about 23% radiologists, 20% radiologists used AI tools. Today, it's 60%. So you've seen in 4 years a rapid adoption of AI in medical imaging because we are seeing that return on investment and improvement in patient outcomes by using AI in clinical workflows. So really excited about it.
Well, I'm going to be a little biased just because I am an AI company. What I've seen AI able to do, especially for my industry, in working with people with disabilities is just amazing. Just in the past 2 years since the latest GPTs and LLMs were released, the progress that's been made has been amazing. And while there hasn't been a lot of healthcare adoption directly, the supportive technology that's been able to be used has been amazing. And from what we've been able to build with Zero Divide AI, if you asked me last year, I don't think we would have been able to build it. So I really think that AI is changing the way that people engage with technology. So while it might not be directly used for the care purposes, the supportive aspect of it can never be underestimated. Everybody wants that home run hit in technology. I was a CIO for 13 years, like I mentioned, and everybody wants to have that solution that's a home run. But sometimes if you get 4 hits, that's the same as a home run, and I think that's really what AI can do right now.
This program is presented by This.Labs, a framework-agnostic consulting firm helping enterprises realize their technical goals through staff augmentation, consulting, project management, on-demand subject experts, training, and other professional services. Find out more at This.Labs.com.